Anxiety disorders. Anxiety disorders are a group of mental health conditions characterized by excessive worry, fear, and nervousness that can significantly impact daily life. These feelings can be constant or come in waves and often interfere with sleep, work, relationships, and overall well-being. There are several types of anxiety disorders, each with its own set of symptoms. Generalized anxiety disorder, GAD. People with GAD experience excessive worry and anxiety about everyday situations, such as finances, health, or work deadlines. This worry is often accompanied by physical symptoms like fatigue, muscle tension, headaches, and difficulty concentrating. Social anxiety disorder, SAD. Also known as social phobia, SAD is an intense fear of social situations where someone may be judged or scrutinized by others. People with SAD may avoid social gatherings, public speaking, or even eating in front of others due to the fear of embarrassment or humiliation. Panic disorder. This condition is characterized by sudden and recurring panic attacks. Panic attacks are episodes of intense fear that come on quickly and reach their peak within minutes. During a panic attack, physical symptoms like chest tightness, heart palpitations, shortness of breath, dizziness, or sweating may occur, leaving the person feeling like they are losing control or even dying. Phobias. Phobias are persistent and irrational fears of specific objects or situations. Examples include arachnophobia, fear of spiders, claustrophobia, fear of enclosed spaces, and acrophobia, fear of heights. Phobias can cause significant distress and avoidance behavior, making it difficult for people to engage in activities or go to places that trigger their fear. Mood disorders. Mood disorders are mental health conditions that cause significant changes in a person's mood, emotions, and energy levels. They can affect how you think, feel, and act, and can interfere with daily activities. The two most common types of mood disorders are depression and bipolar disorder. Depression, a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. It can cause feelings of sadness, loss of interest in activities you once enjoyed, changes in appetite and sleep patterns, and difficulty concentrating. Bipolar disorder, a mental disorder that causes extreme mood swings that include emotional highs, mania, or hypomania, and lows, depression. During a manic episode, a person may experience excessive energy, racing thoughts, impulsive behavior, and poor judgment. Depressive episodes can cause feelings of sadness, hopelessness, and loss of interest in activities. Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder, OCD, is characterized by repeated unwanted thoughts, obsessions, and urges to perform rituals or behaviors, compulsions, to manage the anxiety caused by these thoughts. Common obsessions include fear of germs, contamination, or harming oneself or others. Compulsions may involve excessive cleaning, hand-washing, checking things repeatedly, or arranging things in a specific order. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, develops after a person experiences a traumatic event, such as a car accident, assault, or natural disaster. People with PTSD may experience flashbacks, nightmares, and severe anxiety related to the trauma. They may also avoid situations or reminders of the trauma. Eating disorders. Eating disorders are conditions characterized by abnormal eating habits and unhealthy body image concerns. These conditions can have serious health consequences and can significantly interfere with daily life. Examples include anorexia, nervosa. People with anorexia have an intense fear of gaining weight, even when underweight. They often restrict their intake of food and may engage in purging behaviors such as vomiting or laxative abuse. Bulimia nervosa. This condition is characterized by episodes of binge eating followed by purging behaviors such as vomiting, laxative abuse, or excessive exercise. Binge eating disorder. People with this disorder experience recurrent episodes of uncontrolled eating in a short period of time. Unlike bulimia, there are no purging behaviors associated with binge eating disorder. Schizophrenia. Schizophrenia is a chronic and severe mental disorder that affects a person's perception of reality. They may experience hallucinations, seeing or hearing things that aren't there, and delusions, false beliefs. Schizophrenia can make it difficult to hold a job, maintain relationships, and function in daily life. Personality disorders. Personality disorders are inflexible and enduring patterns of thinking, feeling, and behaving that deviate from cultural norms and cause distress or impairment.